This is a comparison of peritoneal dialysis and hemodialysis. Peritoneal dialysis involves an indwelling catheter placed into the peritoneal space in your abdomen. It's slower than hemodialysis, and it's typically done at home. On the other hand, hemodialysis involves a line that goes from your blood vessels to an external machine. It tends to be faster, and it's usually done in the hospital. Now, there are some reasons you might use peritoneal versus hemodialysis. Peritoneal dialysis is usually used in pediatric populations and in patients with residual renal function. So if you're still making some urine, you might be a candidate for peritoneal dialysis. On the other hand, if you have no renal function, if you have no urine output, and if you have end-stage renal disease, you might need hemodialysis. Hemodialysis should be avoided in patients with cardiac conditions like coronary artery disease, unstable angina, aortic stenosis, and poor cardiac function in general. This is because hemodialysis can introduce swings in blood pressure that can induce hemodynamic stress. Hemodialysis is usually the go-to for emergent cases, and it usually has increased solute clearance. So you usually go to hemodialysis if a patient has electrolyte abnormalities that are life-threatening.